Dr. Paul Firnhaber. Normally we do this on Wednesday, but we're doing it on Thursday today. So we're doing 10 minutes of truth. We've got another very important article that I want to go over with you. This article is a little older. It's May of 2016. It's out of the British Medical Journal. Again, one of the top 5 medical journals in the world. And the name of the article is Medical Error, the third leading cause of death in the United States. Now, one of the things that makes this article so interesting and important is the author was Marty Makary, who is now head of the FDA. And not only is he head of the FDA, but he wrote a book called Blind Spots, which I did some 10 minutes of truth on. I read it several months ago. It's a 2024 copyright. And in that book, he talks about how many of the health problems that we suffer from in our culture today were from the overprescription of antibiotics, which is pretty interesting. Now, he's just the head of the FDA now, so that's a really good thing. He wasn't when he wrote this article. So let me talk about some of the key points from this article, and I'm just going to quote, "Medical error is not included on death certificates or in rankings of cause of death. Marty Makary and Michael Daniel assess its contribution to mortality and call for better reporting. They analyze the scientific literature on medical error to identify its contribution to U.S. deaths. The annual list of the most common cause of deaths in the United States, compiled by the Center of Disease Control, the CDC, has a major limitation as it relies on assigning an international classification disease, which is an ICD code, to the cause of death. And ICD codes do not include error. So it can include error as a consequence of communication breakdowns, diagnostic errors, poor judgment, inadequate skills. So they ask in the article, it's an important question, how big is the problem? So they go back to 1993 when there was a study from Harvard that reported the incidence of iatrogenic deaths per year was 180,000. That's in 1993. In 1999, a publication from the Institute of Medicine reports the incidence of fatal medical error between 44,000 and 98,000 annually. However, this report is limited and outdated. That's interesting. That's a pretty wide gap, 44,000 to 98,000. You know, you wonder how they did that study. In 2004, a report of inpatient deaths associated with the Agency for Healthcare Quality Research and Patient Safety Indicators in the Medicare population estimated that 195,000 deaths were caused by medical error a year. The U.S. Department of Health and Human Services Office of the Inspector General, examining the health records of hospital inpatients in 2008, reported 180,000 deaths per year due to medical error among Medicare beneficiaries. So this is only among Medicare patients, nobody else. A 2010 study published by the New England Journal of Medicine conservatively estimated that 134,581 hospital deaths occur a year from poor inpatient care. A 2011 study published in the journal Health Affairs said that adverse effects in hospitals may be 10 times greater than previously measured to over 400,000 deaths per year. A 2013 literature review published in the Journal of Patient Safety estimates a preventable adverse event incidence in the range of 210 to 400,000 deaths per year associated with medical errors among hospital patients. So, and they made a very important note in the article, and Dr. Makary says, of note, none of the studies captured deaths outside inpatient care, those resulting from errors in care at home or in nursing homes or in outpatient care such as ambulatory surgical centers. So Macari says, we calculated the mean death rate from medical error at about 251,000 people a year. We believe this understates the true incidence of death due to medical error because the studies cited rely on errors extractable in documented health records and include only inpatient deaths. It says in this article, medical error is the third biggest cause of death in the United States and therefore requires greater attention. If medical error was a disease, it would rank as a third leading cause of death. So, pretty scary stuff if you want to know the truth. And again, this article was written by Marty Macari, who's now the head of the FDA. So, I would ask you, what do you think? How many people do you think die from chiropractic care every year? I'll tell you, if we were to round up, it would probably be one, maybe one. So the question I would ask you is what's more dangerous, medical care or chiropractic care? You know, there's a lot of, in the past and even somewhat in the present, there's been a lot of chatter and speculation and accusation that somehow chiropractic care is dangerous. Well, medical care, they're saying, is killing at least 250,000 people a year. And, one person maybe might die from chiropractic care a year. So I think the numbers speak for themselves. Natural health care is safe, it's effective, and it's way less costly than medical care. And I would recommend, if you're not getting anywhere, with the care that you're receiving in medicine, maybe you should try chiropractic or functional medicine, which we do here at the Lincoln Disc and Nutrition Center. It's far safer, it's less expensive, and maybe we can get to the underlying root of what's causing your problem. So if you're interested in calling our clinic, our number is 402-488-2220, and I would recommend calling soon if you have a problem. Why let it go? Why let it get worse? We'd love to be able to help you. I hope you enjoyed and got something out of this journal article I talked about today, and next week we'll be back with another 10 minutes of truth. This is Dr. Paul Firnhaber. We'll see you then.